Good afternoon. I'd like to welcome everyone to this week's edition of Imperial as One's Belonging series, where we explore the lived experiences of individuals from the Black, Asian, and minority ethnic communities. It's really a pleasure to be able to hear their stories and to share their experiences with them. And as they tell us about their journeys into finding their sense of identity and belonging. And I say this every week, and every week it proves to be true. I haven't lied as yet. I say every week that we've got a really special guest, and this week is no exception, because this week we've got Wendy Kwok, and Wendy is a senior teaching fellow in the Faculty of Medicine and School of Public Health at Imperial College. She's also a trained veterinary doctor. But I'm going to let her explain her story. So Wendy, it's a real privilege to have you with us. And I'm going to kick off by asking the question I always ask at the start is, can you tell me what it is or that gave you your sense of identity, your sense of belonging as you were growing up?
Thanks for having me. It's great to be here. I think growing up, it's complicated, like I said when we met earlier. Um, but I think I think I started out feeling like I didn't belong really because like, it was a very formative experience. But the first kindergarten that I went to, it was back in the day. I grew up in Hong Kong, and back in that time, they wouldn't allow children to use their preferred hand if it wasn't the right hand. So then my parents didn't think that was okay. So then they changed me from a local school system to an international school. And then that sort of set me off in this kind of trajectory where I was a little bit apart, I think, from other children from Hong Kong.
Yeah.
I think, yeah, my family thought, I think my extended family were kind of like, oh, she's a little bit foreign. So I always felt a little bit different growing up.
Yeah.
I didn't necessarily feel like I belonged.
Yeah. And was that partly because of the fact that you weren't necessarily mixing with local kids on a day-to-day basis, as it were? Yeah.
Yeah. So my contemporaries, I suppose my classmates at school, they were usually they often had some sort of link to Hong Kong. So ethnically, they were mostly Hong Kong Chinese, but they usually had some sort of connection with the Commonwealth. So say they might have lived in Canada for a few years and then come back to Hong Kong or Australia or the UK for that matter. But I think one difference between that kind of school, the environment that I grew up in relative to a local school, was that it was a lot more mixed in terms of backgrounds. So I got to meet people from different places who had really different experiences to most kids in Hong Kong. It was less homogenous.
So it was less homogenous. So it was lots of different ethnicities and backgrounds that you were.
Yeah.
So how do you think that made you in those formative years? How did you view yourself relative to the other children that were in your vicinity, as it were?
I think it became more obvious to me that I was maybe a little bit weird or a little bit apart from my peers the older I got. I think especially in secondary school. In primary school, I didn't necessarily feel like I stuck out like a sore thumb as much. But I think, as I grew up, um, I was quite bookish as a teenager. We didn't have television for several years, but we did have a whole room full of books. And I was always spending my time in the library because I really loved to read. And so I think that made me seem a bit strange in the eyes of my peers at secondary school. So my group of friends at secondary school was kind of a collection of all the people who weren't really accepted by other people, but we were very tight. I think we got on really well. I still keep in touch with them now. I spoke with one of them earlier this week. So I belonged with them, I
Yeah.
think. I didn't necessarily feel like I belonged in this broader kind of school with my peers.
That's interesting, because sometimes we think that we have to belong to a whole massive group. But what you're saying here, correct me if I'm wrong, is that you gained your sense of belonging just from that small peer group, uh, and the fact that you felt that you didn't necessarily belong to the wider group. It was okay because you had your little group which you were you did belong to. Am I right in saying that?
Yeah, it was I belong with my near and dear,
Yeah,
I think. And then I didn't necessarily feel the need to sort of be accepted by everyone. I think that's not possible anyway,
yeah,
honestly.
yeah, yeah. So okay, so you gained acceptance, you gained your sense of belonging, identity. Did you get your sense of identity, who you were from that group as well? Because
I
there's
did,
one,
yeah.
yeah, okay.
I did, I think, because we were all sort of in the same boat, kind of. We're not really local enough to be accepted by our, our families or our kind of family friends and things like that who were kind of raising their children quite differently. Um, but we could identify with each other, right?
Hmm.
We're kind of all going through the same thing.
Hmm.
So I think that was very powerful for
Yeah.
me.
So you identified within each other the
Mhm.
differences which then connected you.
Yeah.
Yeah. All right. Okay. That's good. So what kind of things you said that you had a passion for reading, passion for books, and that you didn't have a TV. So what kind of things, what other things kind of like excited you, got you really interested? What were your interests, I should say?
Oh, there were so many. I've been playing piano since I was 5. I think
Hmm.
because of the lack of TV, my summer holidays were always full of like handicrafts. So I was knitting, sewing. I still
Hmm.
do that now.
Yeah.
Uh, that's kind of my hobby in my downtime when I'm not at work.
Hmm.
Uh, so I was very kind of hands-on
Hmm.
in my sort of downtime. Yeah, all of that, I think. And my friends were quite similar. They like to read and write as well, or they were artists, they like to draw. So we always had that kind of in common.
Hmm.
It's nice. Because you learn from each other, right? Like
Yeah.
they learn their craft over time and then they kind of tell you how they do it. And then that
Hmm.
kind of opens your eyes to, oh, I could be doing things like this instead, or that there's this technique that I had never thought of before.
Hmm. So it was like a, I'm not going to call it a knitting circle, but it was it was it was a community circle where you shared experiences and you helped each other progress both in school academically, I'm
Mhm.
assuming, and
Yeah.
also outside of school. So you became really close, as it were.
Yeah, actually, like now that you mentioned that, so I'm not the only vet amongst that group. So we definitely did influence each other in terms of
Right.
where our careers ended up going. So there were at least 2 other vets in my immediate social group, actually, at
Right.
secondary school. So they're still practicing now.
Right. Okay. Well, let's push on to that then. So clearly you had a passion for education,
Mhm,
and your parents definitely encouraged you with that passion for education. You had a peer group as well
mhm.
who were passionate about education. So tell me where you're, I know where it's going, but tell me where you're, how you got into kind of like going into veterinary practice and veterinary studies. What was that pathway for you?
I think for me, it was that instinct of I always, whenever I see someone being left out or like a stray in the corner, whether it's a person or if it's a cat or a dog, I'm always like, oh, I have this instinct to go and pick them up and be like, oh, you should be included. Come along.
Yeah.
And so that's the foundation for my friend group. And I think that instinct then translated into I'm going to do that with animals as well. And that sort of informed my career choices. Um, yeah, that's and also because I like a challenge, I was kind of quite like bookish. I was
Yeah.
very, very into my studies. I was quite a high performer at secondary school. So I was like, I want a challenge. I picked the hardest thing I could think of, which was veterinary medicine, even harder to get into than medicine.
So it was the challenge that was driving you. Do you
Yeah,
do you think that I'm just looking at the idea of this challenge? Is that the idea behind that challenge that it was do you think you were trying to prove yourself to others, or were you trying to prove yourself to yourself, or was it just the joy of the challenge that
a bit of
you
all three, I
go
think.
on? Okay.
It was a bit of all three. I think there was always the expectation from my parents that I would have a professional job of
Yeah.
some sort because they were professionals as
Yeah.
well. So it was sort of just a given. Yes, you're going to go to university. Doesn't matter what for, but you're definitely going to go.
Yeah.
And preferably by the end of it, you will come up with some sort of professional qualification so that, we can relax and you can have a stable adulthood and, you know, sustain yourself. So there was always that kind of expectation, and that was very much the demographic that I came from. Pretty much everyone I went to secondary school with then went on to university. That was kind of a given.
Mhm.
But there was also sort of me, like, what can I do? What am I capable of? Can I do this really hard thing that people say is, you know, really hard to do?
Mhm.
Like, can I overcome my own expectations sort of for myself?
Yeah.
Yeah. And the
So,
joy of it. I did enjoy it. There were parts of it that were really hard, but I did enjoy the process. I think I look back on it now, I'm like, I don't know that I would repeat vet school again. But when I was doing it, I think I learned and I changed so much, I think. So I wouldn't not do it if I was at that point in my life.
okay, so I'm gonna kind of like try to segue from one to the other. So you went to international school in Hong Kong.
Mhm.
Where did you then do your veterinary practice?
I went to Glasgow for vet school.
For so why Glasgow?
But there was no vet school in Hong Kong at that point, actually.
Right, okay.
So
Okay.
you had to go overseas in
Yeah,
some way. And the reason I chose the UK was because my both my parents were educated here. That's where
yeah,
they met. And so it was sort of almost a given because I grew up with these stories about them going to university. And so my dad actually did both his degrees at Imperial. So I grew up
right.
with stories about Imperial and what, you know, life was like as a student in London. And so I kind of always had this expectation that I would go to the UK.
Yeah,
Like that was a very popular destination anyway for
yeah.
people from my secondary school. So that's how I ended up there without ever having been to the UK before. Like flying there at 18, completely on my own, like 16 hours on a plane, and like completely like, oh yeah, I'll just have the sheer bloody mindedness to go and do that and not like even feel a little bit of fear. I don't think I'm that fearless now.
It was it that you were trying to get away from Hong Kong, or go, because it's pretty much as far as away from Hong Kong as
Yeah,
you can
the
possibly get?
opposite side of the globe, basically. Yeah, I think it's because I never really felt like I belonged in Hong Kong. Like I did try several times, so I've been kind of jumping back and forth between the UK and Hong Kong for many years. So
Mhm.
I grew up in Hong Kong, went to Scotland for university, went back to Hong Kong, practiced for a few years, came back to London actually, did my master's here, and
Mhm.
then I went back to Hong Kong, um, and worked as a veterinary researcher for a few years before coming here, and
Yeah,
then now doing the job that I'm doing. So it's been
yeah,
a bit kind of circular, but I think I've tried many times to kind of, you know, find my feet, put
yeah.
down some roots there, and never really felt like it was somewhere where I could do that.
Okay, I'm going to explore that again in a minute. Uh,
Mm.
yeah, I'm going to explore that again because that really does interest me. But in terms of then this, I'm going to call it a brave young 18-year-old who's going across the globe to the other side of the world, right? No no family, I'm assuming that you had.
None,
Yeah,
not in Scotland, no.
not in Scotland. So you're there by yourself. How was that? How was that transition for you? What was it like in those opening terms?
it,
Um,
it was a shock. It was just everything was different. The food was different, the people were different, the accent. It took me 3 months to figure out what anyone was saying in an ordinary conversation. Like people were nice there, you know. I would look lost on a bus, and it's the very Glaswegian way where they come up to you, all right, last, you know. And then I couldn't understand what they were saying. I was like, I'm really sorry, but can you repeat yourself? It was really embarrassing because I was like, I thought I knew English, but apparently not. So that was a bit of a shock, just the basic kind of communication, figuring out like how to be an independent adult and all that kind of thing. I think, yeah, I did feel welcomed, but on a sort of temporary basis. They're like, oh, you're a student, that's all right, you're going to be gone in 5 years time.
yeah, yeah, yeah. So culturally, there was a big shock.
Oh yeah,
What about academically in terms of?
that was a shock too, actually. I think it was
Uh,
the next step up, right? You're used to being a big fish in a little pond, like the
yeah.
most academically gifted amongst a cohort of maybe 200 students. And then you come into this class and, you know, your contemporaries are, you know, people who've done a first degree already. We
Mm,
had quite a few, I think about a third of our class was mature students from the States. So
right.
like, it's just, you can't compare, you know, someone who's already been through the educational process. Like, it's just not the same.
Yeah.
So I think then I kind of just, I was like, oh, okay, just put your head down and carry on. Made
Did,
it through.
so did you kind of like revert back to, because you said that your passion was books.
Hmm.
Was it that you almost like reverted back to say, okay, I know my safe space
Yeah.
is my books.
Yes.
It's so, is that how you kind of like coped in those first few months or?
Yeah. Yeah, it was actually. I would stick my nose in a book, go to the library, borrow everything that was related to my modules, and that was kind of what my kind of safe place where I could go when I was feeling like, oh, I'm like alone or I'm
Yeah.
stressed. Like that was my sort of comfort, if you like. I did end up making some really good friends. Again, people who were maybe a little bit on the fringe and didn't feel accepted by the rest of the people in my vet class.
Mhm.
Those people ended up being the ones I stayed with for like the entire time. We
Yeah.
became very close. I'm again still in contact with some of them now,
Yeah.
even though
Yeah.
we don't even live in the same country anymore.
Yeah.
They're
Yeah.
like Australia, USA. I'm texting them on the
Yeah.
regular and seeing how they're going. So it was like again, it was kind of I belong with them.
Yeah.
Yeah, I found
Yeah.
my tribe there, I think, but I didn't necessarily feel like I belonged to the whole group.
Yeah.
Used to be a theme in my life.
No, 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 that's fine. I'm also just curious, I suppose is the word, about what happened with support services from the university or along the, were there role models or were there mentors, champions who kind of like, other than your parents, because your parents already knew that, you're going to do, but was there anybody else who was there to lend that support, or was it just confined to your support network, your group of friends?
Yeah, I think it was mostly my support network. There really wasn't very many people who looked like me in
Yeah.
vet school. There were maybe three other people in my class of 140 who were from Hong Kong, actually.
Okay.
But again, it was because I didn't feel like I identified. They went to a local school, so
Right.
there was a little bit of a gulf between us anyway. I think I felt more comfortable with the international students.
Hmm.
They're used to operating kind of between cultures, the so-called third culture kids. Those were the
Yeah.
ones that I was like, oh, I understand your experience.
Yeah.
You're used to going to international schools. You've been jumping around different countries. Like, you operate between the
Yeah.
cultures. You're comfortable in that space. That's where I'm comfortable. So those
Yeah.
are the people who I end up being friends with,
Yeah.
not the people who look like me
Yeah.
necessarily or
Yeah.
even come from the same place. But I
Yeah.
didn't feel that kind of sense of belonging with them, funnily.
Yeah, no, 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 that's fine. To me, it's always very interesting to hear about the experiences during the formative years,
Mm.
because that's where it kind of like helps to it the reasons why they're called formative is because that's where you form a lot of your connections and your value systems and stuff like that. But so in terms of then practicing, going through the through your university course and then going on to practice as a vet, how was that? Where did you practice as a vet, and what was it that kept you going as a vet, a practicing?
Oh,
What did you
I
enjoy about it?
I practiced for about well, 2.5, 3-ish years, and I went back to Hong Kong for that. Uh,
Hmm.
and that was a real education, I think, because it was the first time that I was getting to meet people from all different walks of life, which I
Hmm.
had never been exposed to before. I think I had a
Hmm.
very privileged childhood where I was kind of in a bubble, really, with
Okay.
all these other children who also had professional parents, and so you kind of abstractly understand that you're very privileged, but you don't really have any real experience to explain kind of what that gulf is between the rich and the
Yeah.
poor. It's very exaggerated in Hong Kong,
Yeah.
especially.
Okay.
So then people would bring their animals to me, and then I would say, "Oh, we can do this, that, and the other," and then but their perception of what's a reasonable amount of money to spend on your animal was completely different to mine. And
Yeah.
that was a big shock for
So,
me.
so can you give us an example, if you can remember any, or when you say there was a big shock, is there anything that stands out that in
Yeah,
your
there were some
memory?
really heartbreaking cases that I dealt with. I remember there was a teenage boy. He was like sort of late teens, and then he came in with his mom, and they brought their cat because their cat had unknowingly jumped off their balcony, which was a couple of floors up, and
Oh.
landed in a flower bed. And so she was very unwell. And
Mhm.
so I was like, okay, we need to do some basic checks. Let's do an X-ray, see if there's any broken bones or any kind of organs that are damaged. And it was quite extreme. damage. And so I explained to them, like, here are the options, but it's not looking very good. But that's what those options would cost. And I think they were shocked by the cost of even the basic kind of first aid that I had to do. Like that was unaffordable for them. Whereas for me, it was like, you know, you brought me this cat, I can't do nothing.
Yeah.
Right. We ended up having to put her to sleep because
Right.
they couldn't afford the cost. And I think that was the thing that drove me out of practice, actually, because I was like, I have all these skills to save lives. And yet so much of the time I can't do that job. I can't make animal lives better. And, you know, by association, the lives of their humans
Yeah.
better with my skills because of money or because of some other kind of factor. Time sometimes was also an issue. Um, so that's kind of how I got interested in sort of the more like systems sort of perspective on animal health and looking at kind of, you know, oh, animals actually often have the same kind of diseases as their humans because they have the same lifestyle.
Yeah.
And so that got me thinking, like, what are we not doing earlier to prevent these problems? Because when they, by the time they come to me, all I'm doing is slapping a band-aid on it. It's not actually preventing it at source. We're not
Yeah.
actually protecting their health. So that's how I got into doing my master's, which was on One Health and infectious diseases, where, you know, you could potentially have a little bit more influence at a population level, and then you would then hopefully be able to help more of the people who are unable to afford care for either themselves or for their animals, right?
Yeah. So give me an illustration of when you say this One Health and infectious disease, encapsulate what that actually means in terms of the study, because you've kind of like alluded to the fact that you are looking at the impacts of health on animals, but also how that impacts, or the two are linked through the human. So can you give us an illustration of what you mean by this One Health perspective, or this One Health system, as it were?
Yeah, it's the idea that animal, human, and environmental health are inextricably linked.
Right.
So the example that I gave about the cat with diabetes earlier, sometimes I would diagnose an animal. I'm like, oh, your animal has diabetes. This is what diabetes is. And then they would say, oh, actually, I know what that is because I have it. And that
Mm-hmm.
would be down to the lifestyle of
Mm-hmm.
the, you know, the human and the animal because they live
Yeah.
together. Right. So that's just one example. But there's lots of diseases where this applies as well. You know, things that avian flu is a really good example of that, right? We farm chickens for food, and then but that requires us to be in close association with them. We keep them in large volumes, like very large numbers and very cramped conditions sometimes.
Mm-hmm.
And then that's a place where, you know, the virus can reassort, it can evolve, and then it passes into the human population, potentially becomes a pandemic, right? And then that also has impacts on the environment because that way of farming has its environmental damages as well. And then so that kind of, it's the whole animals, humans, it's all whole. It's one whole.
So it's not isolationist, as it were.
Mm-mm.
You're looking at how everything is, how things intersect,
Yes.
and the impact of those intersections
Yeah.
on individuals, or
Yeah.
on the whole system.
Populations. Yeah.
Yeah.
On the system, on populations, at all the levels.
Yeah.
Yeah.
That's so, and that your interest in that came about because of what you experienced in your practice.
The frustration that I felt, I think that I could do, there's so much more that I could do to make
Mm-hmm.
their health better. But I
Mm-hmm.
wasn't able to do it because of constraints that I had no control over as a clinician.
So in your kind of like the role that you've adopted now and having done, how now can you impact and make a difference, which you felt that you couldn't do before, if that makes sense?
Yeah, it's a little indirect, I think, relative to
Yeah.
where I thought I was going to be with my career. I thought I was going to be just dealing with animals because, you know, my first degree was in veterinary medicine.
Mm-hmm.
Um, but I think now I get to look after a population of students as
Mm-hmm.
part of my job, and
Mm-hmm.
then to you know, tell them about, you know, this holistic way of thinking about animal and human and environmental health. So I get to kind of spread the gospel, if you like. And then I also get to, you know, these are the public health leaders of the future, right?
Mm-hmm.
So what I teach them may at some point filter down to how they do policy, practice, and research. And
Mm-hmm.
like I think that's how I'm trying to, like, give back, if you like, to my
Yeah.
community.
Yeah. Yeah. So there is a lot then around, because there's practice, I understand about the practice, but the policy side, what
Mhm.
do you think needs to be done, or what would you say needs to be done for when I think about, I was looking at something with regards to in Ireland where they've got this green gloop. They call it the green gloop, but it's the algae which is growing up, and it's because of human intervention which is causing those things and the impact there. So how can policy help to change that? What is it that you would say would be at the heart of those decision making?
I think the thing that is most lacking right now is that most government departments still operate in silos. So the human health kind of does their own thing, animal health does their own thing, environmental health does their own thing, and there's not enough interfacing
Mm-hmm.
between them and not enough collaboration between them, so that they're sort of repeating almost the same things. They're reinventing the wheel for their own specific purpose, but they're not actually, getting the co-benefits of working together. So I think we need more of that, and that would be kind of a fairly broad strokes thing to say, I think, but that's the trend that I've noticed in my years working in this area.
So it's that silo effect
Mm-hmm.
and the lack of transmission of information, or the
Yeah.
lack of learning from
Mm-hmm.
mistakes which somebody else has made.
Yes. Yes, or like the having to reinvent the wheel because
Yeah,
everyone's like trying to address the same thing, but they're all kind of taking their own spin on it and not actually working together to
yeah,
achieve a
yeah.
goal. Yeah, I see that repeated quite a lot.
Is that frustrating? Would you say that that's frustrating, considering what the potential? Because I always look at, I kind of like look at what happened during COVID.
Mhm.
Yeah. And parts of me think there was some really great stuff that happened. And then parts of me think there were some really terrible things which
Mhm.
also happened.
Great.
Yeah. Um, and so in terms of that, it's kind of like how do we learn the lessons, and how do we influence to make effective change?
Oh, that's a really
Um,
hard question.
yeah,
I would
sorry, I
I
got
would
all
say
philosophical on you. Sorry.
I would say, like, I think it's the nature of kind of the political cycles where politicians think in short term, and then it's really hard for them. So they react when there's something like a pandemic, right? It's an emergency. And then when it's over, they're like, oh, we don't need it anymore, so we're not going to fund it.
Yeah,
And then it kind of falls to the wayside until next one happens. And
yeah,
because the world is so globalized now, right? I could be at the other end of the planet within 24 hours. So,
yeah,
this can spread really easily. So you
yeah,
really should be doing your pandemic preparedness and your kind of planning. But I think the way our political systems are structured don't necessarily permit that
yeah,
to the extent that is required to keep us
yeah.
healthy and safe. Yeah. So I don't have a good answer to that, but I would
No,
say,
that's fine.
yeah, and I keep telling my students, I'm like, you're not going to solve the entire world's like health challenges. Pick your one thing, stick
Mhm.
to it, build your tribe around you,
Yeah,
right? Have your community work together. You're going to get further like that than if you try and go it alone.
absolutely, absolutely. So tell me, when you spoke about your transition from veterinary practice into this one health system, this global practice more that you're doing in public health, because the title is belonging, have you gained a better sense of belonging in, or is it different between when you were doing your veterinary practice
Mm.
compared to now when you're doing the work as a teacher, senior teaching fellow, and promotion of the One Health kind of, not One Health message, but as the One Health, and a much more integrated approach.
Yeah, I think I feel like I belong more here than I have in
Mhm,
any other job that I've
mhm,
done before. I think partly because there are not a ton of role models who look like me in veterinary medicine. Like
mhm,
it's still a very kind of, I think, imbalanced profession in that
mhm,
way here and elsewhere. Um,
mhm,
Whereas I think public health and teaching is much more varied. I think, and
mhm.
that's where I feel more at home because that's what I was used to growing up, right? I'm
Yeah,
used to being between cultures. That was
yeah,
normal for me. And I think it was too monocultural almost in vet school for me, like that I
yeah.
didn't really feel like I belonged
Mhm,
there.
mhm,
Whereas here, like I like the variation, I like the different perspectives that people bring. I like the fact that people have worked in all different kinds of places and they have something different to say about this
mhm,
one health perspective, right?
mhm,
And
mhm,
that's the part that I really enjoy, actually getting to talk to colleagues and students about, what have they experienced? How do they see what it is that I'm telling them about One Health? How do they apply it in their own setting? That's
Yeah.
the part that's cool.
Yeah. So, I think it goes back to that curiosity that you had as a child, reading everything that you could
Mhm.
possibly read. And now here it's almost like implementation in your practice, in that
Yeah.
you're seeing people come from all over. I don't know, this may be me thinking about it too globally, but you see people coming and you're giving the message, but asking them, put that into your local context.
Mm.
What does that look like for you?
Yeah.
and and ultimately I don't know whether that will then help us on a more global scale to be able to say, okay, that's what it looks like in Taiwan, that's what it looks like in India or in Bangladesh or in Kenya or Nigeria. So tell me how these systems can work,
Hmm.
because that's what we're looking for, isn't it?
Yeah, how do we adapt? Because you can't just assume a one size fits all, right? That's
That's
something
right.
that works in one context, does not need adaptation, and can be implemented somewhere else. I think
Yeah.
that's probably generally untrue,
Yeah.
actually. But I think, drawing on what people know locally about their context is really valuable, right? Because otherwise, you can come in with the best of intentions and, what you think is a good idea, but it's just going to fall flat on its face because you haven't thought about, is this acceptable? Is this something that the local population wants?
That's
Like,
right.
you thought about all of these things? Have you included them in the decision making, or are you imposing your
Mm,
idea of what's good for them
mm,
on them, right? Which I
mm,
think makes me think back to like my clinical years. It was the most successful, I think, when I could meet the client where they were at and say,
mm,
to them, all right, what is it that you can afford, and what is it that you can offer your pet in terms of time,
mm,
for addressing this health need that they have, right? And I have to be realistic about what I tell you to do. I cannot prescribe you something that you have to give 5 times a day if you're only at
yeah.
home at night,
Yeah.
right? Things like that. So it's that, but on a grander scale, not just a
Yeah.
one-to-one kind of consultation, but at a kind of program level.
Yeah.
Yeah.
So, no, that's fantastic. That's fantastic. When just a few minutes ago, you said that one of the things which you felt had hindered progression is the siloed nature of how people interact.
Mhm.
Um, and just thinking about just thinking about your the description of your school days, and people being, you and your friends almost felt othered,
Mhm.
so you didn't fit in, you know. Um, and I'm just with my concept of belonging and values and whatever else. How would you describe, or what kind of value systems, or what kind of, how do you think you could have been helped to feel as though you belonged more? Or did you need that, do you think?
Mm, I don't know that I think I needed it at that age,
Mhm.
actually, because I belonged with some
Because,
people, right?
yeah,
And that was very fulfilling for me already, I
yeah.
think. So I didn't necessarily feel like I had to belong with everyone else.
Hmm.
Yeah, it was, my friends were good enough, more than good enough.
Yeah, your friends. That makes perfect sense, because sometimes I just think, like, with the impact of things like social media,
Mm,
and people posting and things like that, and how that can sometimes have a detrimental effect on
mhm,
people's mental health and well-being and things like that, because they're thinking, I'm not I'm not doing these things and people aren't involving me, but everyone seems to be doing those things, and etc. And they then have that sense that they don't belong, as it were.
mhm.
So I don't know, I'm not sure where that question's going, to be honest,
Well,
but
I understand that kind of the fear of missing out, right? But
mhm,
that's what's on social media is really someone's highlight reel. You don't
mhm,
see the low points usually. People don't talk about that. It's not cool
yeah,
to post that
yeah,
usually. And I think for me, because I sort of didn't feel belonging to the wider group as a kid,
mhm,
uh, it sort of almost didn't I didn't have as much. The fear of missing out was not so strong for me because I was like, well, I'm already sort of on the sideline, sort of being a wallflower. Like,
yeah,
and I'm actually quite happy here. I'm enjoying myself. Like, I get to, read my books, I get to do my hobbies with my friends, and all that kind of, it was a rich and
mhm,
fulfilling kind of life already.
Yeah.
Like I didn't really feel the need to keep up with the Joneses, as it were.
Yeah. Yeah.
And
No,
I think I
absolutely.
had that kind of instinct from a very young age, and I'm still like that now. I think I'm
Yeah.
like, oh, good for you, do your thing, Like if you want to go and do that, kind of, great, okay, it's not necessarily for me, but if it makes you happy, oh, cool.
Yeah.
And like I don't necessarily feel the need to kind of, oh, I need to like measure up to that. Like I think I always had a really strong sense of self.
No, that's such a brilliant point which you've made there, that you didn't allow, it sounds to me that you didn't allow anybody else's metrics to be the things which influence your decision.
Mm-hmm.
Yeah. That
Yeah.
other than the fact that you wanted to do well,
Mm-hmm.
right? Other than that fact, it was that I don't, as you said, you don't have to keep up with the Joneses. You
Yeah.
don't have to be in the in crowd to feel that you're in part of you were satisfied, that not self-reliance, but you were happy with yourself.
Mm-hmm. Yeah, I didn't feel like I needed that kind of external validation, as it
Yeah.
were. Like validation's an inside job. You
Hmm.
give that to yourself. I think you have
Hmm.
to accept yourself. Like
Hmm.
I didn't. I think I understood from very early on that I could not expect to get that kind of fulfillment from outside of myself. You have to do the work on yourself.
But where did that come from, do you think?
I think
Because
it was
that's
my parents. It
your
was my
parents.
Yeah.
Yeah.
They were always like, what are your values? Be true to yourself. Like, don't measure yourself by what someone else thinks is good, because that might not be the thing that works for you. Right.
Right.
Like,
Right.
what's your compass? Follow that.
Yeah.
And that was like knocked into me very, very early.
Right, fantastic. No, because so this is why I always start with my first question. What values or what was it that gave you your sense of identity? And there we have it. We only took 25 minutes to get there, but there we but but there we there we have it. It's that value system that your parents instilled in you that actually just it permeated your life so that you didn't even have to think about it. It's part
Mhm.
of who you are. It's part of your identity.
Yeah. I think there were times when I did struggle with it when I was like a younger teenager, I think.
Okay.
As I kind of matured a little, then I think I kind of would question like, what's the purpose of being in the in crowd? Like, is it
Hmm.
really all that it's knocked up to be
Hmm.
to be popular? Like, is that
Hmm.
what matters? And if you have to pretend to be someone that you're not in order to be accepted by other people, is that true acceptance? I think not.
Hmm.
I would rather be accepted by fewer people who truly know who I am
Hmm.
than to pretend to be someone that I'm not in order to be accepted by more people. That doesn't have value for me. It still doesn't have value for me now.
Yeah. Yeah. So
Yeah.
you definitely wanted to always be able to be your authentic self,
Yes.
not not someone who's trying to fit in because that's what other people have told you is acceptable.
Hmm.
That's
Yeah.
brilliant. That's brilliant. No, that's probably been part of your motivation and drive as well. That's
Yeah.
helped you as well, because sometimes um there's a saying, don't get don't get distracted by the noise of the market. So if you
Mm.
go into the market to get something, and you have all of the market stall holders to come over here, come over here, come over here, come on.
So pineapples or watermelons.
And you end up buying a whole load of things which you didn't need, didn't
Yeah.
want, right? Just because you got distracted by all of these other voices. Yeah. But
Yeah.
but from an early age, it sounds like your parents instilled in you, don't be distracted by the noise in the market.
Yeah. Focus on your direction.
Focus on what you have to do.
Yeah.
Yeah.
Yeah, I've always been like that. I think my teachers at vet school actually, so it was in probably final year of vet school when we were nearly ready to graduate, and one of my teachers fed back to me. She's like, "You were always really, really driven. Like you knew what you were here for, and
Hmm.
here you are. You're nearly there."
Yeah.
And that was really kind of gratifying to hear actually
Yeah.
that someone recognized that
Yeah.
I had followed my compass, and that's where
Yeah.
it took me.
That's brilliant. And
Yeah.
it's also reassuring as well
Mhm.
that you know that actually if I stay true to my compass, right, I'm going to get to where I need to get to.
Mhm.
Yeah. I'm not, don't allow myself to get knocked off course, or don't
Yeah,
allow
sometimes you take detours. I think if
yeah.
me at 18 was to look at me now, like, almost 18 years later,
Yeah.
um, that I would be like, how did you end up in this place? Like, what happened to your career? Like, why is it? But I think it's sort of you can't join the dots for,
Yeah.
you know, your career until you sort of have the retrospective perspective and
Effective.
look
Yeah.
back and like, that made sense because if I hadn't done that, I wouldn't have ended up here.
Yeah. Absolutely. Absolutely. So you've kind of like preempted my final couple of questions, right? And that is what advice would you have given to your younger self? That would be the first part of the question. And the second part of the question is, what do you think your younger self would look at you now and say, wow?
I think advice to my younger self would be, I think, not everyone can or should like you. Like, so long as you're not like mean,
Hmm.
then, you know, stick to your course. Like, you know where you want to go and what you want to do, and that has a value for you. That's the most important thing. Be kind,
Hmm.
of course, while you're going there,
Yeah.
but like stay the course. Like, like
Yeah.
trust your instinct and your direction. Like it's going where you need to go.
Hmm. Hmm.
Like, believe in yourself. I think, like trite as that may sound, but
No, it's absolutely true. It's absolutely, you do have to believe in yourself.
yeah,
You do have to believe in yourself.
yeah. But I think if I was say at 16 when I first decided, sort of, okay, I'm really gonna go for this hardest thing that I can imagine doing at this age, I would be like, oh, I made it. Actually, I did it. I tried it, and I think I went through a period of like grief that I'm like, this is not what I thought it would be, and I can't do the kind of good that I chose this career for. But there
Yeah.
are still other ways that you can benefit, you know,
Hmm.
animals, humans,
Hmm.
people. Um, and that's not necessarily a bad thing. It's just you took a circuitous route to get
Yeah.
there, you know, but you will get there at some point.
Fantastic. Fantastic. Uh, Wendy, it's been absolutely brilliant having this conversation with you today. Um, and you know, we're both at the same institute. We should meet up and have some more conversations because
Yeah.
I think there's there's a lot of I really resonated with the idea of um not working in silos,
Mm,
sharing good practice, being able to develop um initiatives and develop ways of working, which is which helps the common good.
mhm,
Yeah. Um, and I think that holistic, that one health approach which you've described, where we're taking into account how what we do impacts on animals, how it impacts on the environment, how it impacts on the humans. I think that's something which I know people say it, but if it's whether or not it's actually being done in a way that is really being impactful and
mhm.
not something which is short-termism and stuff like that,
Yep.
you know, it's I think we really need to take a long hard look at ourselves as humans,
Mhm.
uh, and say, what are we actually doing? So
Where are we going?
where are we going with this?
Yeah.
So thank you so much for your insight on belonging and your identity. And yeah, we want to just wish you all the very best as you continue on your career, wherever it may take you. Right.
It was
Yeah.
great to chat with you.
Thank you very much. Right. I'm gonna just highlight to everyone what's happening next week. I'll just pull it up. So next week we're gonna have Professor Robert McCoya, and he's the professor of chemistry and the pro vice chancellor of global engagement at Nottingham University. Um, and if you have missed any of the other interviews, then please go to the YouTube channel, which is tinyurl.com/belonging IAO, and you'll be able to see, I think if I'm right, we're at about 155. So Wendy is our 155th guest. So thank you, Wendy. Right. All fascinating stories. Every single one of these stories is different. There are some similarities, you know, and when I've sat through and I've listened to, and there are so many things which resonate across continents, across gender, across sexuality, which I think we all should learn from, because in all of these stories, every single person has found their place where they feel that they belong. And so I just want to say just continue to find that sense of who you are, find that sense of what makes you the person who you are, and find that sense of belonging. And until next week, remember the clocks go back this weekend, so please make sure that you're able to, well, everyone should get an extra hour, so everyone don't waste that extra hour. All right. We will see you again in the next week, and until then, have a good weekend.